welcome to Health Talk. I'm Dr. Manny. A year ago, Dr. Ken Brantly became the first American Ebola patient to return to the United States for treatment. The world watched as he arrived in Georgia and rejoiced when he was cured 3 weeks later. Now he and his wife Amber have written a book about the experience called for life, how loving our neighbor led us into the heart of the Ebola epidemic. You were doing a medical mission in Liberia when the outbreak began. What kind of work were you doing there?
I was working with the Samaritan's Purse post-residency program, and I was practicing general family medicine in a hospital. So we were taking care of everyone from babies to elders.
So you were there basically dealing with just the medical needs of the community, like a missionary doctor and all that. So you were doing everything. But at that time, also your family was with you, right?
Yes, we moved there together.
So then all of these Ebola patients, did you expect that you were going to get Ebola outbreaks? I mean,
no, not at all.
So this is happening without your knowledge. In other words, the outbreaks are happening a little bit, right? You're dealing with the medical issues of the mission there, general medicine, deliveries, cuts, bruises, vaccinations, and then all of a sudden they start bringing Ebola patients into the system, right?
Well, we moved to Liberia in October of 2013, and at the end of March 2014 is when we first started learning about the Ebola outbreak in Guinea, and it quickly spread across the border into Liberia and then came to Monrovia.
And were you kind of, when you saw the Ebola patients coming, were you sort of concerned about your family that was there with you?
We were. In fact, at the beginning of April, the end of March, beginning of April, Amber and our children were evacuated. They came back to America.
Almost immediately, right?
Right, when the first patient with Ebola came into the Monrovia area.
What kind of training did you have to go to in order to, to sort of assist what was going on? Because you're a main doctor there.
At the end of March, when we first heard about the outbreak, the doctors in our hospital began preparing immediately. And we were able to download a manual that was produced by the CDC and the WHO online. We downloaded it and created a curriculum, put our entire hospital staff through this hands-on experiential training for weeks. But then we didn't see our first patient until June 11th. So we had the end of March, all of April, all of May to read, to practice, to refine our protocols and our techniques. So by the time we started actually seeing patients with Ebola in our facility in June, we felt very well prepared. We had been training for more than 2 months to be ready.
So you felt confident that, okay, we know what we're doing with these patients.
We did. We felt confident that we could begin the process of caring for them in a safe manner, a way that was safe for us and for our hospital staff. We didn't plan on being the treatment center from Monrovia.
Right.
But that's how it turned out.
Did you feel any symptoms? You had a fever?
I did. I woke up on Wednesday, the 23rd of July, feeling bad. I stayed in my home, and throughout that day I developed a fever, got sicker and sicker, and 3 days later I was diagnosed with Ebola.
Now, you as a doctor, because we doctors self-diagnose ourselves, did you say to yourself, okay, this is not good?
I knew it wasn't good.
All right, so you suspected yourself before the blood test came back that you might have had Ebola or developing Ebola?
I treated myself as if I had Ebola, but I held on to hope that it was malaria or dengue fever or something different,
right,
until we got that confirmatory test back.
All right, so you get that news, and what happens next?
The first thing I did was call my wife to tell her
Amber?
the diagnosis.
Yeah.
Well, how was that phone call?
I don't remember exactly everything we said, but as soon as I answered, he told me, he knew I was waiting for the results, so he told me my test came back and it was positive. And what can you say?
Right.
I'm sorry, Kent. I'm so sorry.
Yeah.
And that was it. And he had to call his parents and tell everyone.
And now there was a period once you got sick, there was no way for you to communicate with him. Did you get updates from the hospital on a regular basis? Because it's difficult.
We were able to talk via video chatting on our phone. And
even while you were
text.
in the hospital there in Africa?
Until my data ran out on my phone.
What were some of the most critical or life-saving decisions made about your care?
I think in Liberia, one of the decisions that was made early on is when Dr. John Fankhauser decided to start supplementing my fluids with potassium.
Because you were losing a lot.
I was having a lot of diarrhea, and they had no way to run any lab tests, so
Right.
they couldn't check my potassium level, they couldn't check my kidney function. But he said, he's having a lot of diarrhea, he's probably losing potassium, let's supplement it.
Right.
When I arrived in Atlanta, they found out that my potassium level over my first day there dropped critically low. So had John not been giving me potassium, I very well may have died.
You get to the U.S., what happens next?
When I arrived in Atlanta, everyone saw me walk off that ambulance, and I think some people thought, oh, he must not be that sick. I was still critically ill.
Yeah, because you
when
walked
I
out of the
arrived.
ambulance, right?
Right. In my first couple of days in Atlanta, I think my doctors used the words cautiously optimistic.
Right.
And over the first 5 to 7 days, my course really started to improve. My diarrhea lessened, and my condition started to stabilize more. And after my first week there, it kind of started to become clear that I was going to make it, and just had to take time to recover and for my blood test to turn negative.
Now, you became a political piñata, right? Because everybody in the U.S. says, oh, no, he's not coming back, right? Wasn't that the case? Did you feel that pressure? Did that bother you?
Yes.
Yeah, and I mean, we can.
Sure
Hey,
it
this is
did.
Fox News.
Because I wanted him here. I wanted him here with me, and I wanted to be
Right.
able to see him through the window.
And you knew that
and bring him food.
there was no
and-
way to treat him where he was. No laboratory tests that they could do. I mean, they were sort of flying, without any instruments.
It made a huge difference, not only in his medical treatment, but in his spirit. I think coming to a facility where he could have round-the-clock nursing care and the labs and everything else, the supportive care that he needed, gave him so much more hope. And I could see the relief on his face, even though he was still critical. I just focused on Kent and what we could do to help him and his family, and we just stuck together. We didn't pay attention to the naysayers. That we can't take it personally. It wasn't Kent. They don't know Kent.
Right.
It was Ebola,
Right.
but he put a face to it. And I
Right,
think
he
without
did.
his recovery, the attention couldn't have been drawn to West Africa.
What have you learned from this whole unique experience?
One thing I have learned from this is this reality that we live in a global community. Mm-hmm. That those people in West Africa who are continuing to deal with this ongoing outbreak
Absolutely.
even now, they really are our neighbors, and our lives impact one another.
Through your book, if people, and I want everybody to please get this book, it's a wonderful story. What do you hope to communicate?
We hope that this story, that our story, will encourage people, that it will offer people hope, that it will encourage people to ask and wrestle with difficult questions. You know, we've wrestled with a lot of difficult questions through this journey over the last year, and we continue to wrestle with the questions of why me? Not only why did I get sick, but why do I get to live when more than 11,260 other people have died and are continuing to die every week? Mm-hmm. So I hope that our story can help encourage people to wrestle with those hard questions.
Right, right. How are you doing today?
I'm doing very well.
Right?
Thank you.
Fully cured, fully recovered?
I've made a full recovery.
Do you ever plan to go back to Africa again?
We hope to. That's the life we feel called to, and that's what we would like to get back to doing.
That's why the book Call for Life was written. Thank you so much both for being
Thank
here.
you, Doctor.
All right. And if you have any health topics you want to talk about, send them here at Fox at Dr. Manny at foxnews.com. Until next time, I'm Dr. Manny.